If I will just check on the YouTube.
Please check. 10 minutes இருக்குல்ல.
Yeah, I'll just check on the YouTube if it's.
Can we also start recording? We'll take the YouTube la தெரியுதுங்க ஓபன் ஆயிடுச்சு.
தெரியுதா?
இன்னும் ஓபன் ஆகல. இதாயிடுச்சு பஃபர் ஆயிடுச்சு.
Yes. I will just check on the YouTube.
Please check. Open 10 minutes இருக்குல்ல. Speaker view இல்லல்ல.
Yeah, I'll just check
gallery
on
view
the
கொடுத்துறலாம்ல.
YouTube if it's.
Can we also start recording? We'll take the YouTube la தெரியுதுங்க ஓபன் ஆயிடுச்சு.
தெரியுதா? The YouTube one is a bit slower, so I think that is the reason.
It's slow. It's a few seconds slow.
I will just check on the YouTube.
Please check. Open 10 minutes இருக்குல்ல. Speaker view இல்லல்ல.
Yeah, I'll just check
gallery
on
view
the
கொடுத்துறலாம்ல.
YouTube if it's.
Can we also start recording? We'll take the YouTube la தெரியுதுங்க ஓபன் ஆயிடுச்சு.
தெரியுதா? The YouTube one is a bit slower, so I think that is the reason.
Yes, the YouTube is very slow. நான் அதை இப்ப பாஸ் பண்ணி வச்சிருக்கேன். நம்ம ஸ்டார்ட் பண்ணதுக்கு அப்புறம் ஆன் பண்ணிக்கலாம்டா.
Yeah, நானும் பாஸ் பண்ணி வச்சிருக்கேன்.
Okay, better.
But நம்மளோட ஸ்கிரீன் மட்டும் தான் பாஸ்ல இருக்கும். It will be live streaming only if somebody else sees.
Okay. For others it will be live only.
Yeah.
Okay, நாம இங்க ரெக்கார்டிங் வந்து ஆன் பண்ணிருக்கல ஆல்ரெடி. நீங்க யார் ஆன் பண்ணது ரெக்கார்டிங்?
I think recording is already there.
Automatic recording ah?
Yeah, already on the call setup lay automatic மேல காட்டுது recording.
But how do we save it at last?
It will get automatically saved, I guess, in the local computer whichever you're using. Host oda computer la save ஆயிரும் நினைக்கிறேன்.
Okay. Copy streaming link கொடுத்திருக்கேன்.
So அந்த இது YouTube live மட்டும் கொஞ்சம் ஸ்டாப் பண்ணி வச்சா after the presentation start.
நானும் இது YouTube ஓபன் பண்ணிருக்கேன். சோ நானும் பாஸ் பண்ணேன்.
வருதுல அது?
There are 3 on the waiting room already. Gladson, Ramesh and Rajkumar. So Rajkumar sir நம்மளோட இவர் தான் நினைக்கிறேன். அவர் அட்மிட் பண்ணிருக்குமா?
அவர உள்ள விட்டுறலாம்.
Hello. Hi Rajkumar sir. Gokul here.
Soundarya has also joined. Can you let her in?
Sure, I will. No, she's not.
Hi Gokul.
Hi Rajkumar sir.
Yes.
How are you?
Oh, fine, thanks. How are you?
Nice to see you, sir.
Yeah, nice
I'm also introducing the others on the group. They are the co-hosts.
Please.
And there is Nandini and Vinita. They're all part of the Tamil Nadu Urban Sanitation Support Program.
Yes. Hi,
They're based out of Coimbatore.
Hi. Hello. நல்லா இருக்கேன். How are you? How is everything? Good.
Yes.
Good.
So we will start in another 5-10 minutes, sir. Once all the speakers are in, then we can start allowing all the people to join.
Fine. Did you get my presentation?
Yes, sir. I have it with me. Yeah.
You will help me in projecting it. So
sure. I'll project it. Yeah.
Thanks.
So what we thought is, sir, we can, if you can just run through the presentation real quick, then we can also take more questions.
Okay.
So if the participants are posting a lot of questions, then it will be good for you to kind of, answer these questions from your experience in working with schools and other areas with communities.
Okay.
So anyway, Bala has sent only an audio. He couldn't attend the webinar. So we will have 4 speakers. So most of them have shared a presentation too. So they will also be presenting.
Fine.
Each of you all can take kind of, like 5-10 minutes presenting, and then we can open it out for discussion.
Okay. After all the presentation over, then we'll have the discussion, or as it
that
is,
will be good, sir. Yes. I think for now, that's what we are thinking.
Yeah, that will be nice. Okay. Yes, fine. Yes. Thanks.
Gokul Krishnamurthy sir irukkaru.
Okay. Admitting. Nandini and Vinita, do you want to introduce the speakers? Just lock the room.
Hello, Krishnamurthy sir. This is Nandini here.
I'm
Hello.
here.
Hello, sir. Can you hear me?
Hello?
Hello.
Yes.
Sir. Good afternoon, sir.
Good afternoon.
Yes.
Are you hearing me?
Yes, sir. Yes. You are audible. So, here, co-hosts are Vinita and Gokul. Oh. Yeah.
Hello, sir. Welcome.
Hello?
Hello, sir. Gokul here from Keystone Foundation.
Here.
Our another presenter, Soundarya, is here.
Yes.
Hello, Soundarya.
Hello, sir. I'm Vignesh from Keystone Foundation.
Hello, I'm Krishnamurthy.
Yeah, thank you, sir.
Hi, Soundarya. Welcome. I think she's on mute.
Hello.
You can unmute her.
Yeah, you are audible, Soundarya.
Hello,
Hello.
am I audible?
Yeah, yeah.
Yes, you are. Yes, you are.
Okay. But my video is not working.
Your video is not working. Can you leave and rejoin, ma'am? If that's possible.
Sure. Yeah, sure.
Please see if that works. Vinita, any update from Mr. Shankaranarayanan, NMCT?
I think he'll be joining shortly. I'll just give a call to him. But I think, can we just stop? Okay, let the YouTube live go on. But I think people might see we are talking over.
On YouTube, do you want to stop? It's paused, no?
I think only our play is stopped, but the live is going.
Oh, okay. So what do I do?
Just think on the more button. Is there live stream for a second, or should I give end stream for a second?
Yes, maybe. See, we can restart.
Is there live stream? Sorry for the delay. I think we're a couple of minutes late. So, welcome to the webinar. Sorry for the delay. I think we're a couple of minutes late. So, welcome to the webinar.
Vinita, sorry for the interruption. Your voice is not clear.
I think it is echoing.
Sorry for the delay. I think we're a couple of minutes late. So, welcome to the webinar.
Vinita, sorry for the interruption. Your voice is not clear.
I think it is echoing.
Sorry for the delay. I think we're a couple of minutes late. So, welcome to the webinar.
Vinita, sorry for the interruption. Your voice is not clear.
I think it is echoing.
Sorry for the delay. I think we're a couple of minutes late. So, welcome to the webinar.
Vinita, sorry for the interruption. Your voice is not clear.
Can everybody put your mic on mute, please? Yeah. Gokul?
Now it's clear, Vinita.
Yeah. Gokul? Hello? Gokul?
Yes, Vinita, tell me.
Yeah. Gokul, can you please go ahead? I am just checking with Mr. Shankar Nari. He has some issues with the link and logging in. I'll just join back.
Sure. I'll do that.
Sorry for insults.
No problem. Good evening, everyone, and thanks a lot for showing interest in this webinar. And this is part of the Tamil Nadu Urban Sanitation Support Program. I'm sure that a lot of y'all are aware about this project, and there is a lot of importance. Can the participants kindly mute their audio, please? Okay. So we have been doing a series of webinars, especially looking at water, sanitation, and hygiene post-COVID, especially in the schools for children's and educational institutions. So today we have some of the eminent speakers who are among us who have been in the field of sanitation for a very long time and also experienced on various heads on sanitation and water. And we have Mr. Rajkumar. He is a consultant with a rural development organization in the Nilgiris, working in the Nilgiris. And we have Mrs. Soundarya. She is the zonal head of U&I Foundation. She is based out of Coimbatore. We have Krishnamurthy sir. He works for an NGO, for India NGO, which works across India on aspects of water and sanitation. And we also have another speaker. He's not joined yet. He will be joining us shortly. He is Mr. Shankara Narayanan from NMCT. And so there was another speaker. His name was Bala. He's an expert on water and sanitation as well. He has been on the development field for around 2 decades. So he couldn't join us today. So he's also shared an audio, which we will play later on if there is time. So now I think I will start with Mr. Rajkumar to make the presentation, and he will kind of share a brief on the brief of the work that Audio Trust and he has been doing in the Nilgiris and in other parts of the country. And from there on, we will hand it over to Mr. Krishnamurthy. He will also be making a small presentation, and then on Ms. Soundarya, and then later on Mr. Shankara Narayanan. So the participants can kindly leave their comments or questions in the chat, and we will take it up later on when there is time for discussion. And our speakers will be addressing some of these questions. And we kindly request our participants to keep your audio on mute and try to put your questions as much as you can on the chat. Yeah, so that we also have a document in field. Thanks a lot for this opportunity, and I would ask Mr. Rajkumar to take it off.
Thanks, Gokul. Good evening and good morning to everyone listening to this webinar. And I would first like to thank Keystone for giving me this opportunity to share our experience with you all, and also the Tamil Nadu Urban Support Sanitation Program for giving us an opportunity. So as Gokul said, nobody, it's not an expert talking, but it's somebody talking from the field of whatever we have experienced for the past 2 decades of work in sanitation. So I'd like to quickly, can we have the first slide, please? Share. I'd like to quickly go through the journey of the next one, please. The journey of Audio Trust in the sanitation sector. See, having worked with the women self-help groups from 1998, Audio Trust has been trying to understand the entire livelihoods of the rural communities and more in terms of the vulnerable groups of women, children, the elders, and the physically challenged. And that's where the point of sanitation comes in, because working with self-help groups, the microfinance which is provided mostly goes to their priority areas like livelihoods and all that. But Nobody has been looking at how best they could improve their living conditions. So, but the most vulnerable people there are the women, the children, and the elders, and the physically challenged. So in 2008, we also found out that the Nilgiris, it's a sad state of affairs, Nilgiris ranked second in the state of Tamil Nadu for open defecation. So this lovely, pristine ecology and environment of this hill station, it was really sad to note that we were ranking second. So that also made us to enter into the field of sanitation. So we started launched the whole sanitation program in 2009 to campaign for Nilgiris to become an open defecation free district by 2020. So the campaign started with a lot of awareness programs and distribution of IEC materials, which we developed, and also a lot of trainings for groups and for the masons. This was mainly because we were trying to assist each household through the self-help groups for the first time, provide sanitation loans for the groups. And that's when during our awareness program, another important thing happened. That is, part of the awareness program was in schools also, because we thought we would like to make use of the students as sanitation ambassadors to go and talk to their parents that they must have a toilet facility, a bathroom and toilet facility at home. So that brought us to light that the children in the schools, when we interacted with them, they said, "Sir, what are you talking about toilets at home when we don't have proper toilets in the school where we are spending most of our time here?" That was a real something for us to look at. So that's why that is when we also said that we will do something for the school sanitation. So in 2010, we launched our school sanitation program, and also right now, currently, we have also done a circular economy and sanitation for agriculture program. Next slide, please. So the school, next slide, please. The school sanitation program, the individual household toilets, first let me talk a little bit about the individual household toilets. About 68,000 toilets have been built with the help of the microfinance provided, and for each toilet it was about 25,000 rupees, and the repayment was very good. Again, the reason was not the infrastructure, but more the ownership of the whole program itself by the women folk. See, actually, the toilet was then earlier, probably people were looking at it as a luxury, but then toilets after the women got their loan, when they had constructed the toilets, they thought they really said that it was a nice asset to have. So that was the crux of the whole thing. So the involvement of the women, that is why we went into training the masons and making the women themselves buy the materials and construct their own toilets. Next slide, please. So coming to the school sanitation program, we had initiated in 450 toilets in 50 government schools and aided schools, and also private schools, benefiting a total number of 19,107 students. Specifically, if you look at 9,899 female students have benefited from it. And the most significant impact has been the reduction in dropout rate of the girl child from schools from 23 to 2%. See, now again, the design of this is a prefabricated design which we have followed, which is more user-friendly in terms of if you can see from the picture, it's more user-friendly with the ramp leading in, and there's a hand wash inside the toilet itself. And then there is also it is also well equipped with a good containment system, which the government has done. This we were able to also do it with a lot of support from the government side, where they pitched in with their Sarva Shiksha Abhiyan funds to provide the water facilities as well as the containment system. Next slide, please. So the next one we were looking at is also the importance of the hand wash when it comes to sanitation. So 10 hand wash units have been constructed in 10 schools just as a model to show, and each had 22 taps. Each of the unit has 22 taps. And we found that this was very much necessary when we talk about the sanitation facilities in school, along with the toilets. The next. The key challenges I would like to share with you, though everything looks so good, we had a lot of challenges to confront too, and let me just quickly go through that, because when you talk about the infrastructure, infrastructure alone does not is not the main problem, but the key challenges now what I will be sharing with you is related to the after infrastructure, the whole management of the whole infrastructure facilities, wash infrastructure facilities. Next slide, please. So one major factor was that a lack of toilet water facilities in schools, which, as I earlier mentioned, we were able to talk to the government and try to get in their funding for providing those facilities. And we were shocked when we found that there was no water facility in schools. Then the next was the less number of toilets as per the recommended ratio. We have specific ratio for students. They say that below 5 years, there needs to be a toilet for every 10 students with a wash basin, and then 5 to 11, one toilet for 20 students, and then over 11, one toilet for every 20 students. So, but that ratio was not there. So it was really sad. And whatever toilet facility was available in some places, the teachers were mainly using the toilets, and the children were still practicing open defecation. And that becomes more difficult for the girl childs when they come to school. The next was no provision for disposal of sanitary napkin in girls' schools, which is, again, the reason why there was a lot of absentees during the monthly period time for the girl child. And then so that was another major issue which we came across. And the design of the toilets also were not that friendly for the physically challenged. And then improper containment system. Again, there were toilets there, but the entire containment system was either not functioning or not adequate. So all these aspects we were able to talk to the government and try and see if they could support us. And that's how we were able to be successfully complete all the 450 school toilets. The next major issue, the social issue, is the maintenance and the management issue, because who is to maintain these toilets? Who is to clean? So that also we managed to talk to the chief education officer of the district, and they allocated funds to each school for the maintenance and management of the toilets. And the use of the toilet when it's close by to habitations, that became another problem, because the public had an access to the toilets, and there's also a lot of antisocial elements who make use of the toilets during the holiday times and things like that. We all are quite well aware of that. Another major problem was, again, the theft and the vandalism. Then when you see those lovely taps there, people are tempted to take it away, and also those lovely closets. And the wash basins. But overall, what I feel is the mindset of the community to treat schools is just another community property resource. I say that because mostly community property resource becomes a resource for everyone, but nobody needs to take care of it. Like so, from that, it had to move towards more of a community property, actually asset, like or a community owned resource, from common property to community owned resource. You know, the ownership issue is very important. So we also have been talking about to the government about setting up the management committees and making the parent teachers association play a more proactive role in maintaining the school infrastructure. The next, please. So this is in short what we like to share with you. We have had an enormous support from the district collector and the chief education officer. NABARD had also provided a lot of financial assistance for the individual household toilets. And then for the school toilets, it has been mostly from the Japanese government, and also I forgot their, it was Sandoz, the CSR project. And our partnership with the Waste Stitching in Netherlands has really pushed this whole sanitation intervention of RDO Trust to a bigger level, and also the Finnish society so that we could expand to other states of India. And the solid waste management and the fecal sludge management project, the circular economy and sanitation for agriculture, was supported by USAID. And we'd like to thank them at this point of time. So that's in short what I'd like to share with you. Thanks a lot once again, everyone. And next slide, please. I've also provided my email ID and the email of RDO Trust. If you have any questions, please feel free to mail us, and we'll be happy to respond to you. Thank you very much. And once again, thanks to Keystone and also the Tamil Nadu Urban Support Sanitation Program officials for giving us this opportunity to share with you our experience. Thank you.
Thanks a lot, Mr. Rajkumar, for giving your time here, and also, talking a lot about sanitation, especially, like in the Nilgiris, where the hills, like we have so many other challenges added with the entire climate, the communities, and cultural barriers and all that. So I would like to ask Mr. Krishnamurthy to now go ahead with your presentation. I will share the screen right now.
Good evening.
Good evening, sir. Please go ahead.
Hello.
Yes, Mr. Krishnamurthy, can you hear us?
Yes, now.
Yes, please
Okay.
go ahead, sir. Your presentation is on. Yeah.
Yes. Thank you.
Krishnamurthy, sir, are you in or have we lost him?
I think he lost connection.
He lost connection.
Yes.
Okay, I think we will wait for him to rejoin. I have not got
Okay.
any notification. Just wait. So in the meanwhile, if you have any questions for Mr. Rajkumar, you can please type it in the chat box. We will take it up later on.
Gokul, I think we can ask Soundarya to go next.
Yes, please. Yes. I think we should do that.
Yes.
Yeah. I kindly request Ms. Soundarya to go ahead with the presentation. Vinita, can you see if Ms. Soundarya is there online?
Can you hear me?
Yes, we can hear you.
Great evening to you all. I deem it a great honor and privilege to propose my views and experience the WASH in this platform. I thank Keystone Foundation and Tamil Nadu Urban Sanitation Support Program for organizing this event. In a UNI Foundation, mostly they will consider upon children education only. But after my UG, I joined with the UNI Foundation and revealed many environmental projects and campaigns and awareness program into the primary and secondary school students. In Coimbatore, there are 133 schools, government school students are there. School students, this is to 121 government schools. We are conducting this awareness program to the elementary and necessary primary kids. As Mr. Rajkumar told, all the necessary and essential things about the sanitation, and let me coin into a very simpler things, as I classified this into the two major types as pre-COVID and post-COVID. Um, as we know that what is the condition in our schools that we have before COVID. But as you see, only 52% schools are qualified in hand wash facilities, but 45% they don't have it. In Coimbatore region, we have classified that 22 blocks are there in our district region. In 22 blocks, there are so many government schools are embedded, but on the totally, there are the 344 government schools are totally embedded in this region alone. But we are having only a 38% in proper sanitation facilities and uh, wash facilities are there. And but on the whole, before the pre-COVID and post-COVID, in pre-COVID we have only 38%, and in post-COVID after this while within 2 months tremendously increasing, and it reached to the 48% in Coimbatore region itself. But I am very sure that before the school reopens or embedding on the school reopens, it will really make a new arrival. And governments are taking strategies to develop this alone, for which we can able to support it. And hello, can you hear me?
Yes,
Hello?
we can hear you.
Yes,
We can hear you. Go ahead.
Hello?
Yeah.
Yes, Ms. Soundarya, we can hear you. Please go ahead.
Hello?
Ms. Soundarya,
Hello?
yes, we can hear you. Can you hear us?
Okay, I'm hearing. Okay. Here the we are happen to construct the new toilets, and many we are talking upon construction of toilets keeping on. But here is the construction of toilet is not an important issue. In 344 government schools in our region itself, we are having 318 school. They are having plenty of toilets and plenty of sanitation facilities. But here the problem is maintenance. Maintenance of the toilet is very lacking. And here we need to concentrate upon in post-COVID, the infrastructure is very good, and we have to concentrate upon the maintenance of the toilets. And the second one is the safe usage, operation, and maintenance of the infrastructural. This has to be taught to the school authorities, school maintenance, and the sanitation workers, then to the teachers, and followed upon to the children. We can't teach directly to the children. That is, I think we should teach the sanitation workers and then teachers and then going upon to the children's. And the awareness campaign and programs are done doing it. And many online classes are going on in which the many primary school students are also inducting in that. And now the wash facilities is very, very improved in this. And Gokul, can you hear me?
Yes, Soundarya.
Yes, please go ahead.
Can you share the hygiene to limit exposure in schools?
Yes, it's on.
Yeah, okay. In this, we have taken the following steps to be involved in hygiene to limit exposure in schools. In this, educate, schedule, increase, commute, create access, tips, and develop. Here, the educate portion, we have to educate the children about the symptoms and prevention need to be teach. And next is schedule. Schedule in the sense a regular cleaning and the disinfection of the school has to be scheduled. It's not only the shift-based classes has to be scheduled, it is not like that. But the regular cleaning and the disinfection, maybe it's a fogging also can be scheduled in this. And increase. The frequency interval of cleaning has to be increased, and commute if possible while going bus traveling, like that one child per seat can be involved in this. And shift based classes also will be very good. And create, what is the creation in this, hygiene and the provision of the soap and clean water has to be created. And access, in this access, the limit risk of the exposure or direct physical contact. Physical education classes are also to be accessed, and we should think of that, whether it is to be conducted or not, like that we have to think, and we have to enumerate it. And the tips is the if any children got any respiratory problems or physical hygiene and it is not embedded, we have to take a care of it. And we need to develop a habit of wearing a mask, and a habit of hand washing also we need to develop. This is the main thing I have to be spoken in this here, because we are continuously watching the children's because they are lacking in the hygiene part, and they are not tending to be relatedness. So I need to stress in this point. And I thank you for this great opportunity, the Greece Foundation and Tamil Nadu program. And thank you all. Hello.
Thank you, Ms. Soundarya. I think we will have a lot of questions coming in, and we will now let the next speaker in. Mr. Krishnamurthy has joined the room. Sir, can you please unmute and start talking? We can also share your presentation.
Good evening. I'm audible.
Good evening. Good evening. Yes, Mr.
Good evening. Good evening.
Yes.
Good evening, sir.
Good evening. Can I have the presentation, sir?
Yes, sir. Just give me a minute.
Yeah.
Can you see the presentation, sir?
Yes.
Yes, sir. Please go ahead.
இந்தியா என்ஜிஓ வந்து சென்னையில் யூனிசெஃப் நிறுவனத்தோடு தொடர்ந்து வேலை செய்து கொண்டு வருகிறோம். ஹலோ, கடந்த 25 வருடங்களாக இந்தியா சேவை நிறுவனம் தொடர்ந்து யூனிசெஃப் நிறுவனத்தோடு வேலை செய்கிறது. தமிழகத்தில் சற்றேறக்குறைய 1,10,000 ஆசிரியர்களுக்கு பயிற்சி தந்திருக்கிறோம். குடிநீர் சுகாதாரம் சுத்தம் இதை மேம்படுத்துவதற்காக இதுல பல விதங்கள்லையும் வடிவமைப்புகள்ல பல மாறுதல்கள் செய்து பள்ளிகளுக்கு ஏற்ற பள்ளிகளுடைய
கிருஷ்ணமூர்த்தி சார்,
Yes.
ஜஸ்ட் 1 minute சார். நீங்க இங்கிலீஷ் தமிழ் ரெண்டுலயும் கொஞ்சம் பேச முடியுமா? நிறைய பார்ட்டிசிபென்ட்ஸ் கொஞ்சம் வெளியில இருந்து ஜாயின் பண்ணிருக்காங்க. இங்கிலீஷ் தமிழ் ரெண்டையும் கொஞ்சம் மிக்ஸ் பண்ணி பேசுங்க. தேங்க்யூ சார். தேங்க்யூ சார்.
India NGO works with UNICEF for the past 25 years in promoting wash in schools activities in Tamil Nadu. We have trained more than 110,000 teachers throughout the state. We jointly work with Sarva Shiksha Abhiyan and Trad Board for capacity building activities. We have promoted thousands of schools in Tamil Nadu. In the last 1 year itself, we have promoted 510 schools in 11 districts of Tamil Nadu. All the schools are promoted from 1 and 2 star status to 3 and 4 star status during 2019 and 20. Next, please.
So Krishnamurthy sir, are you on? Please go ahead. Yes. Please let me know when to change the slide, sir. Yes.
These are all various type designs promoted by us. This is the longest girls urinal constructed by us in the Chodinganallur Government Higher Secondary School. We are specialized in promoting the group hand washing stations. The previous one, yes. This we have constructed in many schools. Students can wash their hands from both the sides. This is very unique in promoting the hand washing habits among the students, because there is an indirect monitoring of the students, monitoring of water, monitoring of the steps we have educated and all. And also we are collecting the water in the tub below the station, and we are reusing the water for all gardening purposes. This is one of the unique design of our NGO. The next one is, please kindly change the next slide. This is a girl-friendly toilet block, which have all urinals, toilets, then menstrual hygiene management cabins, plus incinerator attached. This is also we have promoted with various corporate funding in Tamil Nadu. We can share with anyone for the designs. We can also extend our support for designing the toilet blocks. Next one, please. This is the longest urinal of Tamil Nadu. This we have constructed in Sodinganallur Government Higher Secondary School. All our constructions are based on the total number of requirement and the number of seats. That is always we go by that is 1 seat for 5 persons. Next one, please. In all our girls toilet blocks, we are also attaching incinerators, and we are also training them for safe disposal of soiled napkins. We are also forming the girls groups, female hygiene group, and we educate them about hygienic practices to be followed, and how to use the incinerators, and how to dispose of the soiled napkins collected in the incinerator. Next, please. This is our unique design. This is wastewater management. We also promote wastewater management in many schools of Tamil Nadu. All the rooftop water is collected through a filter bed to the below ground sump, and the water is again pumped to the rooftop, used for all the wash stations, hand washing stations, urinals and all. Again, the used water is collected through a filter bed to a common sump. All the urine is also collected, and after mixing that, we are reusing the same for all the trees available in the campus. The solid particles are disposed of through a leach pit, and this is also our unique design promoted in
Krishnamurthy sir, are you on?
Yeah, are you not getting me?
There was a small break, sir.
There's a small break.
Oh.
Yeah, please. Yeah.
Some disturbance here.
You can go ahead.
Please go ahead, sir. Yeah.
This is our wastewater management designs. We have promoted in all the high schools and higher secondary school where there is adequate buildings. We are reusing the urine water collected from those urinals for all the trees of the same campus. So if you visit the schools, you can see greenery everywhere. Next, please. Line சரியாக இல்லை.
Sir, yes, I can see, sir. Please go ahead.
Yeah, next slide, please.
Yes, sir. Can you see the slide? It's on.
Next one. என்ன வந்துருக்கு? அது வந்துருச்சா? ஏதோ some problem நினைக்கிறேன். I'm not getting this. I think some problem in our line. Sir, are you hearing me?
Yes, sir. Go ahead.
Yeah, I'm using another laptop. And we have promoted child-centered governance in many schools of Tamil Nadu. We are using them as child ambassadors to promote hygiene among the rural community, as well as we are also promoting them as monitoring officers or monitoring, what should I say, something like they are the leaders of change in their schools. These students you see, you are seeing none. They are all girls of Saint Govind supported school, Molachur Government Girls Higher Secondary School. We have promoted many schools like this. They are maintaining the water supply sanitation structures of their school. Hello?
Yes, sir. We can listen. You can go ahead.
Yeah. Now we are yet to see the post-COVID situation really in schools. We are now we are on the way to remodify all the hand washing stations constructed by us by making the we are removing alternate taps from the hand washing stations for maintaining social distances, and we are also training the teachers for promoting mask and hand hygiene practices. These are all our present activities. We are willing to extend our support to any one of the agency willing to come forward for promoting schools as washing schools models. We can also share our designs and drawings developed by us. Thank you.
Thank you, Krishnamurthy sir, for sharing your work on sanitation. Next, we have Bala. Bala is not on the call, but he has shared an audio that we thought we will share it with you all. And after the audio is done, I think we can go in for question and answers. So the participants I think we have very less participants, so it's okay to kind of unmute and you can ask the questions directly to the speakers.
Hi, I'm Balachandar, a resident of the Nilgiris. I have been working in the development sector for 2 decades. My main area of work is water and sanitation. Today I'm going to talk about why WASH, that is water, sanitation, health related issues are important in the context of schools in the post-COVID-19 era, and what are the few things that we need to keep in mind while planning for it. I think the first question would be, when there are so many issues facing schools and students and parents, why do we need to talk about WASH? By now, all of us are aware of the nature of the disease COVID-19 and how it is closely linked to our hygiene status. We need to wear masks, we need to constantly wash our hands, we need to avoid coming into physical contact with other people, and so on. So hygiene is a very important factor, and the way to holistically address it is to look at WASH in schools. Also, how healthy we are and what is the status of our immunity is important in determining whether we are able to ward off the coronavirus or whether we get infected, and if we do get infected, how do we emerge from it in a healthy shape. Schools also face multiple challenges. Many schools may be conducting online classes now and would be wondering about transitioning to a physical class like it used to be earlier. Many schools may actually not be able to conduct online classes and may be waiting to reopen the schools, and maybe under a lot of pressure to complete the curriculum or to look at distancing and within classrooms, managing numbers and of students in the school through shift systems or various other challenges. And it's quite natural to think that some of the WASH considerations may not get the kind of attention that they deserve or need in this kind of situation. But it is very important that even if the schools reopen for one day, or even if there are no students but teachers and other staff are coming to school, WASH related arrangements, WASH related considerations should be given the importance they deserve. And among the WASH, if you look at sanitation and hygiene, they are obviously important aspects. Sanitation has received a lot of focus in the last few years at a national level, but water is the key for both. If you need to wash hands, and that too across lakhs of schools across the country with millions and crores of students, it may not be feasible to supply alcohol-based sanitizers everywhere. I think a simple soap and water solution would be more sustainable, more locally available, and easily replaceable. So water availability becomes a very big key. Another thing we should remember is that WASH in schools is not something that is emerging as an issue after the COVID-19 pandemic. It has always been an issue traditionally. Even in better off schools, there may not have been an actual calculation of how many students there are, how many toilet stalls are needed, how many toilets and restrooms for boys and how many for girls. How to stagger access to those services across various classes, how to prevent crowding, do children have enough time to access the services or to drink water, and so on. But these are now coming under a microscope. We need to plan each and every aspect very, very well and make sure that these services are delivered. I think across the country, for girl children, enrollment has been an issue. Maybe that is improving over time, but retention has always been a problem, mainly because of menstruation related issues, the misunderstandings, the taboo, and simply the lack of planning or acknowledgement of that in our school systems. So there is a dropping out of children. They have to suffer due to various health effects, due to unhygienic practices. There is also a safety issue if they are unable to access safe sanitation and they need to go outside the school. And of course, they face a lot of taboo as well. So a good WASH solution in schools would also address some of these concerns which have been there in the pre-COVID era. One important aspect is adequate infrastructure. This may be a long-term solution. These may not be put up immediately, but one thing to do is to look at available infrastructure and incorporate that in the planning if we are planning students in shifts or which classes to bring to the school, which ones to handle online, or if we want to run multiple shifts. The number of enclosed toilets separately for boys and girls needs to be thought about, and not simply the total number of toilets. The wash areas with adequate supplies of water and soap are also very important. Innovative mechanisms like tippy tap, dispensers for water, which are no contact systems, can also be tried. They are also child friendly, and there are many experiments have been done across the country to try out these things and make hand washing popular and make it a regular practice among children. I think historically or traditionally we have not been very good at emphasizing good hygiene practices among our children, or to re-emphasize them. There is no social pressure. We are still a country where a lot of open defecation, open urination happens, and that is socially not considered to be a major problem. So we have a double challenge because our baseline pre-COVID itself was not very strong. So we have to overcome that and inculcate these habits very strongly. The good thing is it's easier to bring about this change among students, and then slowly that can percolate back to the homes and neighborhoods, and that's a good hope. They are also good at doing surveillance and ensuring that each other follows those practices, and to help check any kind of lapses. In terms of coming back to water, I think a lot of the water related thought is around drinking water. And even there, we don't really calculate how many liters of water is required by a child and or a teacher or a staff member, and to make sure that that quantity of safe drinking water of good quality is available. Quality is often not thought about, whether it is drinking supply to homes or within the school. So that is something that we need to really rethink and make sure that enough water is available. This can again be a constraint. If water availability is limited, then we need to look at how many students can be in the school, or whether we need to make arrangements, for example, to pay and buy water and bring it, rather than just relying on some kind of supply. Especially during summer period, when the overall availability of water goes down, we need to keep seasonality into account. So looking at the source of water, the reliability of water, how we can access water. I have visited a village where a village school was promised water supply by the village panchayat, but the water was available 1 kilometer away, and someone from the school had to go and fetch the water. And the way the school timings functioned and the children coming and going, those timings were, it was simply not feasible for someone to go and fetch that water. So they ended up without having much water to manage with. So these kind of things need to be planned right to the point where the water actually becomes available and is able to be consumed. Another related issue is of water has come into the school. It is available in some way to be dispensed to the students. But do students have enough recess times? Are we looking at distancing? Are we looking at a non-crowded way of accessing this water where there is safety also being ensured? Then the recess times need to be longer. Maybe there needs to be a staggering of it. It basically needs to be much more planned than it used to be before. Should students bring their own water from home in bottles? Is it feasible? How do they travel? A lot of these things need to be thought about, and very context specific solutions have to be found. Another important thing is source sustainability. I think the school administration needs to be aware of where the water is coming from. What has been the historic experience with that across seasons? Do we need to plan in advance to make alternative arrangements? If it's a government school, do certain approvals need to be obtained from elsewhere to make the arrangements? Do you need to talk to the panchayat or the local village and have some kind of an arrangement? Is there a school committee, for example? Should there be some kind of a voluntary system? What works in which situation has to be thought about. If alternate sources need to be looked at, they need to be looked at. In case of failure of water, can that be do we consider it alarming enough to stop the school from functioning for some time? So these are questions which need to be thought about. Water quality again is a very important factor. I think the general trend has been that we somehow get certain quantity of water available. It could be village water supply, town water supply, even in a metropolitan city. The quality factor is often the first to be compromised when there is a deficit in supply. But we are talking about a health crisis, a pandemic, where if the then they can all sort of converge in this kind of a crowded or a group environment and emerge from it safe from coronavirus. We need to make sure that water quality is taken care of. At the same time, we should avoid, donating fancy filters and making symbolic gestures, putting it up so that it's all visible. But maybe the quantity of water is simply not enough to service that kind of children, or the basic water supply itself is at risk. So we need to be sensible about allocating resources and make sure that the end product, which is availability of water, sanitation, and hygiene services, is met. And finally, we should look at schools also as sites where change in wash behavior can be inculcated, and that can go back and spread to their families and the rest of the community. It is a very, very big challenge to reopen schools, especially among the younger children. Maybe parents might opt to not send children to the school. Maybe some of the teachers who might have been working on a temporary basis, or whatever resource constraints, teachers may have got laid off by certain schools. To reopen and restart is going to be a challenge. Our digital technologies are not as have not penetrated as strongly that we can just do everything online with the same kind of quality. So there are multiple challenges facing schools, and I think one important factor in children coming back to school is that the parents have confidence, and that fear of contracting corona from a group environment is minimized. And one very important confidence building measure could be to have adequate wash infrastructure in schools, and highlighting that to the parents and children. And apart from the infrastructure and the services, it's very important that enforcing or making sure that children access these, that they wash their hands, they drink enough water, they access safe sanitary facilities. This is also emphasized by the teachers and staff in various schools. Thank you.
Yes, I think now we are done with the speakers, and we couldn't connect to Mr. Shankaranarayanan, who was supposed to give a talk from NMCT, but he will share a video with us shortly. So if there is time, we will share that video, or otherwise, I think we will write to each one of you with that, or the link to that video. So now it's open to the participants to for questions. So if people have questions, please raise your hand or unmute and go ahead with the question. And the speakers, please, you can take that question one by one. And each one of y'all, if you all have an answer, and if you also have some questions that you wanted to pose to the participants or ask or interact more, you can go ahead and do that. Open to you all. Any questions?
Okay. If there's no question, I would like to just quickly share something. Is it all right? Yeah.
Sure, sir. Sure. Yes, go ahead.
As Bala had just now mentioned, there's a lot of challenges now, especially when we are going to get back to the academic or the schools reopening, right? But first of all, that's what I shared in the chat box also. We would like to thank the schools who have played an excellent role in accepting to have these COVID care centers. It's really something for them to do, actually, you see, because here, if you say even COVID, if the neighbor is affected with the positive thing, then the neighbors don't seem to be happy to look at you also. So sorry, that kind of a situation is there. But here is a school which has come forward to schools and colleges, their campus to accept for the COVID care. So the responsibility is more when the school starts. So how best are we? Sorry.
Mr. Ganesh Pesingli, you have a question? Please go ahead.
Yeah, good evening to all. Myself Ganesh Babu Pesinghi from Wash Initiate, Bhadrachalam. So thanks for sharing some important things regarding school wash activities. So just I want to know, just I want to ask Mr. Krishnamurthy ji. I had seen some beautiful pictures, hardware pictures in your lab presentation. My question is actually you have constructed a girls' toilet, a very huge toilet block, I think. That's very nice to see. But just my question is, so how we are managing in rainy season? Because I think it is a roofless, I think. So am I audible? Hello? Am I audible?
Yes, you are audible. We will wait for Krishnamurthy sir to answer your question.
Yes, yeah.
I'm
just
online.
I want to know. And another thing is just another wonderful picture is there that a group hand wash station. It's a very the first time I'm seeing like that. Of course, we have been constructing some toilet hand wash stations in our area, operational area. Nice, but the thing is actually, is it child friendly hand wash station? Because if you see the if in a particular as a class, so there are some height differences there, children's height. Some people may 3 feet, 3.5 or 4 like that. So just I want to know, so how you are overcoming that issues?
Yeah, we have designs. Hello?
Yes, Krishnamurthy sir, go ahead. We can hear you.
The longest urinal, now it has the roof. This photo was taken before the roof was laid. Hello?
Yes, sir. And there was also another question about child-friendly hand wash. Yes.
It is normally everyone can use, but we have some other designs also suited for the heights according to their heights and all.
Okay. Okay, sir.
You can share. Multiple level hand washing stations are also there.
Okay. Thank you. Thanks for responding, sir.
Thank you, Ganesh. Thank you, Krishnamurthy sir, for your answer. And is there any other questions from the participants?
Gokul, I think there is one question on the chat box. So,
Hello, Gokul.
Yes, Soundarya ma'am.
Yeah. I want to answer the question to Mr. P. Amarnath.
Sure,
He has
please.
been asking me after schools reopen how to protect children in this pandemic situation. He was mentioned in this chat box, and I have to tell them that it is a question um, with a without a proper solution. It has not been identified, and WHO had been given a set of rules, and they have set a guidelines uh, to the schools, for which I have been mentioned in my presentation, that hygiene to limit exposure in schools. There are the 7 to 8 steps to be followed after the school has to be reopened, and that is the answer I can give to them, Mr. P. Amarnath.
Thank you, Ms. Soundarya. Are there any other speakers who would like to address that question? Mr. Rajkumar sir and Krishnamurthy sir, do you have any other alternate answers to that?
No, thanks. Actually, what I was just trying to say, I don't know whether I was audible. Just trying to say that yes, we have to be thankful to the institutions which have given their schools premises for the COVID care centers, but we also have to take the responsibility to ensure that proper sanitization is done. And there's, as Ms. Soundria was mentioning, whether all precautionary measures have been taken before the school reopens. That we will have to definitely ensure that. Yeah, thank you.
Thank you, sir. Thank you, sir.
In Chennai,
Sir, you're audible. Please go ahead.
yeah. In Chennai, we are also working with the Greater Chennai Corporation for these COVID-19 response activities in 4 zones of Chennai with 100 staff.
Okay.
We are promoting hygiene among the slum people. We are also distributing the mask and regular checkups are also done by our team. We are also seeing the schools used by the corporation for the COVID-19 activities. And subsequently after usage, they are disinfecting the entire area. It is happening in Chennai.
Thank you, sir. Yes. The participants, do you have any more questions?
To this, we have undertaken around.
So if there are no more questions, I think there is a video from Mr. Shankar Narayanan, NMCT. I will share that with you, and I think after that, if there are more questions, we can discuss. And if there are questions that you would like to mail us, I think we will also share it with the the speakers, and we will get back with answers to that. So now I think I'll just play the video that we got from Mr. Mr. Shankar Narayanan from NMCT.
Gokul? It's not audible.
Oh, sorry, is it not audible?
Yeah, no, it is not audible.
I am sorry. I think the video is not really working then. I think it's not possible to put the audio separately. Vinita,
Okay.
would you like to try?
Yeah, I'll just try it on mobile. Just give me a second.
Please see. Yeah. Sorry for the technical glitches. I think we will try to get it on soon. Vinita, are you going to be trying?
Yeah. Just
Yes.
just give. Can you see my screen? Mobile screen. Sorry.
Yes, I can.
Yeah. Just give me a second. Can you guys hear it?
No, I can see the video, but the audio is not on.
I think the audio is poor.
It is not audible. Only the video is.
Yeah, the audio is very poor actually. Yeah.
Yes. I think we can share that audio later on with the participants as a link, as an online link. Sorry about the technical glitches. I think if there are more questions from the participants, we can take them. And we can also share our presentation and the work that we are doing on School Wash and other things with you guys on the mail.
Thank you.
Thanks a lot to all the speakers. If there are no more questions, I would like to thank Mr. Rajkumar for immediately agreeing when we called him, and also Mr. Krishnamurthy and Soundarya ma'am, and Bala and Shankaranarayan sir couldn't get on the call, but we'll make sure that on the next call we are on point with the technology, and we will avoid all these confusions that was going on today. So apologies on our part for the technical problems, but again, thank you all for sharing your very useful insights about School Wash, especially when we are in this pandemic situation. It's really alarming, and I think with all such insights shared, we will be able to set up good infrastructure in schools and educational institutions. And before the kids get in schools, we should make sure that the things are in place and all safety measures are taken. Thanks a lot.
Yes.
Yeah,
Thanks a lot.
thank you, Gokul.
Thanks, Gokul, and thanks the entire team of Keystone. Thanks a lot for this opportunity, and the participants and my co-speakers. Thank you. Thanks a lot. Good day.
Thank you, Rajkumar sir.
Thank you all.
Thank Keystone Foundation for giving this opportunity, and personally thanking Ms. Nandini Naraj who gave me this platform and the experience. And finally, thank you for all participants to making this event a resounding success. Thank you. Thank you so much.
Thank you, Ms. Soundarya. Thank you.
Thank you all.
Thank you, Krishnamurthy sir. Thanks for
Thank
making
you.
time. Yeah, thank you.